We've created this short film so that you can see what it will be like when you have your minor operation under local anaesthetic at North Bristol NHS Trust. The reception area for our local anaesthetic theatres can be found at gate 24 on the ground floor of the Brunel building. Please read your admission letter carefully to find out exactly where you will be having your surgery and what time you should arrive at the theatre reception area. This letter will also list any blood thinning drugs that you might be taking that you'll need to let us know about. The sooner you contact us, the better, as some of these drugs may need to be stopped for several days to allow the surgery to safely go ahead. In the week before your surgery, make sure that you get in a supply of your usual painkillers at home, usually paracetamol and ibuprofen if you can take them. Please make sure you have a responsible adult to pick you up from the hospital and someone who can stay with you for at least 12 hours after the surgery. Let us know if this is a problem. Your surgery is under local anaesthetic, so you can eat a light meal before coming to the hospital and can drink as you normally would. Please remember to bring a list of your current medications with you. A recent green prescription form would be ideal. We recommend not to bring valuables with you into the hospital, or if you do, please give them to your friend or relative to take home, as we cannot be responsible for loss or damage. On the day of surgery, please leave enough time to get to the hospital and find somewhere to park to avoid any unnecessary stress. On the day of your operation, you should check in at the theatre reception. This will be gate 24 on the ground floor of the Brunel building. We do try to stagger the admission times for patients, but you may sometimes have to wait a few hours for your operation, so bring something to keep you entertained. When it's your turn, a member of the nursing staff will call you through to the admission area of the theatre suite. To keep this busy clinical area clean and to respect the privacy and dignity of other patients, only one friend or family member will be able to accompany you past reception. The nurse will then take you through a short health questionnaire and will take some measurements such as your pulse, blood pressure, temperature, and oxygen saturations. You'll then see your surgeon. They will talk to you about your operation. They will answer any questions you have and will ensure you have a signed consent form. Shortly before you go through to the operating theatre, you'll be asked to change into a hospital gown. You'll be provided with a bag to put your clothes and any belongings in, and you will bring this with you into theatre. One of the theatre staff will ask you to confirm your name and date of birth, collect your notes, and take you into theatre. In the operating theatre, there will be some other members of staff who are all there to help look after you. They will conduct another safety check where they will ask your full name and date of birth and what operation you are expecting. Next, the surgeon will begin the local anaesthetic injections with a very fine needle around the area to be operated on. The medication will make the area pain-free and numb, but you still feel touch and pressure. You may require more than one injection, and though the injections do sting a bit when they're going in, this does not last more than 30 to 45 seconds. The numbness will last between 2 and 6 hours, depending on which medication is used. When the surgery is finished, you will put your own clothes back on while still in the theatre. The theatre team can give you assistance if you need it, or offer you some privacy if you would rather. You'll then be taken through to recovery, where a specialist nurse will care for you. The specialist recovery nurse will monitor you regularly and will ensure you are comfortable. They can also provide you with a cup of tea and a snack. There are comfy chairs in recovery that you can relax in until you feel you are ready to get up and about. As soon as the nurses are happy you have recovered from your operation and that you have all the support you need at home, you'll be discharged from hospital. Before you go home, you'll be given written advice on how to care for your wound and dressings. Your nurse will discuss this with you and your relative or friend who is picking you up. We hope you find this film helpful. If you have any further questions, please call us in the plastic surgery department. The number is at the top of your appointment letter. Please remember, read your admission letter carefully. It tells you where to go, what time you should arrive at the theatre reception area, any blood-thinning drugs that we want you to let us know about before the day of surgery. Get a supply of your usual painkillers at home. This will usually be paracetamol and ibuprofen if you can take it. You need a responsible adult to pick you up from the hospital. Leave enough time to get to the hospital and find somewhere to park. Bring some entertainment such as a book or iPad. Please also remember to bring a list of your current medications with you. A green recent prescription form is ideal.